everyone. Today, me and my friend Ahlam will talk about two disorders, which are agoraphobia and tutorial. We will discuss the definition, plus symptom, treatment, and causes. So, listen to us. Start.
Okay, first of all, I would like to define what is a phobia. A phobia is a fear of activity or situation or thing that causes one to want to avoid it. And now, what is agoraphobia? Agoraphobia is a fear of being in a situation or being in a situation which you cannot escape or escape being difficult or inhumility.
So now let's know what's the causes. Causes, for example, if you have a panic disorder, with a panic, for example, when you, in a one time, you feel that, for example, when I have in this situation, in this presentation, somebody said to me, "You are today so bad." So next week we have the second presentation. In that presentation, I will be so worried and feel that disorder. Also, other phobias. For example, when you travel, and you every time have the travel phobia. For example, feel afraid from the high place like a plane. Also, you will have other kind of phobia. For example, you will be afraid from to be in an elevator. So two kinds of phobia that can make you have this. Also, experience stressful life events. In your life you have many efforts, many sufferness. That's also cause phobia. And the last cause is which is clear genetic factors. Maybe you inherit that from your family, your mother's father, grands, or so it comes to you by the gene or inheritance.
Okay, typical agoraphobia symptoms include fear of being alone and fear of being in crowded places, fear of losing control in public area, and fear of being in places where it may be hard to live, for example, an elevator or in a train. Also, inability to leave your home alone, and inability to leave your home, and just only able to leave if someone go with you, and also inability sense of helpless. And also, you may have signs and symptoms of panic attack, like rapid heart rate, excessive sweating, trouble breathing, feeling shaky, numb, and also sudden flushing or chills, upset stomach, and also feeling a loss of control, and also fear of dying.
Actually, this disorder start before age 35. In fact, it start almost the time in an 18 age. And also this come in a women more than the men, so the women more likely to have this kind of disease. Also, the Native American, and compared Native American and Asia, the Native American have it more than Asia. Also, last point, low income. The poor people have it more than the people with a high income.
The treatment. What is the treatment for agoraphobia? There are many treatments available for agoraphobia, including specific kinds of psychotherapy and effective medication. Specific kind of psychotherapy that focus on decreasing negative anxiety, proving or other self-defeating thoughts and behaviors also has been found to be highly effective in treating agoraphobia. Another form of therapy is using relaxation techniques in each situation in order to master their anxiety.
Now we'll move to the other disease, which is Tourette syndrome. And let's start with the definition of it. It is disorder witnessed in a childhood, and it's physical. It's physical. It's in body, for example, it's for example like jump or cheating without want that, and at least have one phonic, not screaming or controlling the high voice, just like one phonic like that.
The causes of Tourette's is unknown, but it is well established that both genetic and environmental factors are involved. Also, there is another theory that said maybe it's linked to childhood infection by streptococcal bacteria. It's bacteria that usually cause a sore throat, and also people who have family members with Tourette's are more likely to get it.
Now let's talk about the symptoms. Something having a sudden tics. Do some in physical or water repeatedly, repeat and repeat and repeat. Also involuntary movement, and also sudden phonic, as I said to you, one sound.
Risk factors. Syndrome can affect people of all races and ethnic group. It's more common in boys than in girls. Also, it almost always starts before age 18 and usually between age 5 and 7. Also, kids with Tourette syndrome can get better as they get older, and there's no need to go to doctors or to the hospital.
What about the treatment? Unfortunately, there's no treatment for this disorder, but that text, if it causes a kind of injury or pain, there is a pills for that. But actually, for the common disorder, there is no treatment.
Okay, in conclusion, we have talked about Tourette syndrome and agoraphobia, their definition, symptoms, causes, and risk factor. Both of them, there's no obvious reasons, and both of them has different treatment. In the end, there's any question?